From peripheral artery disease to varicose veins and aneurysms, these conditions can have a big impact on your overall health. Today, Dr. Michelle Kosevec, she's a vascular surgeon with Trinity Health, here to discuss some important conditions that affect millions of people every year. Good morning, doctor. Thank you for being here.
Good morning. Thanks for having me.
Absolutely. Let's talk about these common vascular conditions. What are they?
I treat a lot of conditions including hardening of the arteries, so peripheral arterial disease, hardening of arteries in the legs, carotid artery disease. People can also get big aneurysms in the belly, and also treat things like varicose veins in the legs. Oh my goodness,
I think you just went from head to toe there, doctor. You really did. What are some of the conditions, like what are the signs and the symptoms? What's happening to them?
Yeah, so with varicose veins that are very common, people get, of course, some heaviness in the legs, swelling, sometimes even wounds. Of course, carotid disease, people have strokes or mini strokes, TIAs. Aneurysms can cause bleeding. So yeah, we really are a head-to-toe sort of specialty.
Well, I mean, it makes sense. It's vascular. That happens throughout your body. So when these symptoms occur, something like this happens, someone's noticed some varicose veins, maybe someone has had a stroke. How are they treated at Trinity Health?
So, yeah, I mean, it really depends, of course, on the condition.
So let's start with varicose veins. Let's go with that one. How is that treated?
We often will see them in the office and evaluate for a ultrasound, which is done at the same visit. Oftentimes people will try using compression stockings first to help with symptoms, and we often will do minimally invasive procedures in the office that can more permanently treat those and get rid of them.
Let's talk about that, because isn't that really where it's at? Minimally invasive.
Yes.
Doesn't that give you the best outcomes?
Yeah, we always try with any procedures, even including artery procedures, hardening of the arteries in the legs, we always try to start minimally invasive, stenting or ballooning, and then sometimes, if needed, can do the bigger stuff. Yeah, only if necessary.
Now, there's a term out there that you're familiar with that our viewers might not be, and that's the TAMBE procedure, the TAMBE. Can you break that down for us?
It has a long explanation. It's this thoraco-abdominal branch endoprosthesis. But really, when we are treating aneurysms in the belly, sometimes those aneurysms have extended up higher around the kidney arteries or the intestine arteries. And so traditionally, those have been much more difficult to treat with stenting, again, the minimally invasive approach. And this is the first FDA-approved device that has really revolutionized treating these more complex aneurysms in this area.
What are you seeing with you mentioned the word revolutionary. What has been the big jump with this technology or this procedure?
Yeah, the traditional old way to fix these aneurysms was a huge surgery, and it was a huge incision. There's much higher risks for patients with the stress on the body, as well as months of recovery. So in this case, you're having small incisions in the groin, you're having a small incision in the arm, and you're usually going home within a few days. Much easier recovery and
within
less stress.
A few days?
Yes.
Okay.
I mean, even more weeks of recovery, but not the huge months and pain and all of that.
Boy, anyone who's lived through that right now is saying, boy, I wish they would have had that.
Yes.
But now we do have that, and Trinity Health is offering that. Where can people learn more about this procedure? Obviously, vascular problems can happen head to toe, but for this procedure, the TAMBE procedure, that is for what you were talking about right here. In the midsection, right?
Yes, yes.
Okay, I want to make sure I'm very specific about what the TAMBE procedure is for. If they want to learn more about that, there's a place they can go, right?
Yes, so on our website, I think it will be listed up here, trinityhealth.michigan.org.
That's it?
/TAMBE. We also have a cardiovascular network now between Trinity Health and University of Michigan Health West, where we're able to really partner and provide more comprehensive services to the community here.
Absolutely. Love that, too. I like everything you're saying this morning, doctor. Thank you so much for your time as well and for letting us know where we can go. If this is something that is, well, you're dealing with now, or maybe something you or wanted to deal with, or maybe thinking about those varicose veins, you can go to trinityhealthmichigan.org/TAMBE to learn more about this revolutionary new procedure, minimally invasive treatment. We'll be right back.